Hey dear ones, how are you? Welcome to my YouTube channel. I am really glad and excited to have you on board. For those who are seeing me for the first time, my name is Dr. Victoria. I'm a practicing medical officer in Kenya and one who is very passionate about matters related to women's health. So I want to start a series on healthy pregnancy, and today on top of our list is number 1, blood pressure. It's very important that once you're pregnant, your blood pressure ought to be checked as regularly as possible. This is because when this blood pressure goes up, it puts you as a mother and your baby at risk. So high blood pressure in pregnancy, many times when you come to hospital, or if you have a friend who is pregnant, or if you have experienced it yourself, then you've had doctors speak about pre-eclampsia, PET. This is basically high blood pressure in pregnancy. And high blood pressure in pregnancy could start at any time, at any gestation of your pregnancy. We have different types. We have that which starts before 20 weeks. And right now we are living in a time of the internet, civilization, and a lot of developments in the technical world. So as a woman, it's very easy for you to know what is your gestation. How many weeks are you? When are you expected to deliver? You don't have to count that manually because you have many apps that are there to help you. And this is the app which I use as a health worker. So in this app, all you have to do is just to put the first day of the last time you saw your periods, and then it will give you your gestation, or rather the weeks that you are in, and the expected date of delivery. So we have that which starts before 20 weeks, chronic hypertension. That is the name we tend to use. And then pre-eclampsia tends to start after 20 weeks. We also have another type we call gestational hypertension, which also starts after 20 weeks. But now the difference comes in when you measure urine and you find that in pre-eclampsia, which is the most common one, there's proteins in urine, but with gestational hypertension, we don't have proteins in urine. So what is the cutoff mark for high blood pressure in pregnancy? So in high blood pressure, pre-eclampsia, your blood pressure goes to above 140. This upper value is what we refer to as the systolic blood pressure, and this down value is what we refer to as the diastolic blood pressure. So above 140/90. And you could just have elevated blood pressures in pregnancy that is mild, meaning you don't have other severe symptoms associated with it. And in this case, in a hospital setup, we will, after investigating you well and making sure we don't have other severe features, then we tend to monitor you and put you on medications that will help you at least push your pregnancy to 37 weeks, at which point we will deliver you. At that time, the child will be okay. But then we have some kinds of high blood pressure, pre-eclampsia, that comes in with severe features. And this tends to give us a lot of worry. It puts both the mother and the baby at a very high risk. The child is put at a very high risk of prematurity because there's a high probability that this child will be delivered before term. And then also when this child is in the womb with those high blood pressures, there are issues with the placenta, and so the child is not supported well. You end up with growth restriction of your baby. The mom is put at very many risks because of this high blood pressure. There's a risk of the placenta forcefully or abruptly detaching from its attachments, and you end up with what we refer to as placental abruption, and in this case the mom bleeds a lot, and that becomes very dangerous and also causing complications in different organs of your body. So what are these features or what are these symptoms which when you have tell us you're having severe features. So you find that some people with these blood pressures which are high, and then they come in with very severe headaches, which could be on the frontal aspect of your head or on the back aspect of your head. Some come in with blurry vision, you cannot see well. Some come in with pain around this region we refer to as the epigastric region, pain around the right upper abdominal region. And then in severe cases, because of injury to your kidneys, the blood pressure causing injury to your kidneys, you find reduced urine output. And so management of this high blood pressure will basically depend on the features, on how severe it is. So anytime your blood pressure is high and you go to hospital, there are key tests which will be done. The first one will be urinalysis to check if there's any protein, because if you have a lot of proteins in urine, that points to a severity of the high blood pressure. The second one is a full hemogram. This high blood pressure could cause other complications, what we refer to as the HELP syndrome, and you find that your platelets go low, your red blood cells are affected. We do a liver function test to have a look at your liver because it causes injury to your liver. We do kidney function tests because this blood pressure is going to cause injury to your kidneys. Now, as I've told you, in mild cases, we tend to push this pregnancy up to 37 weeks. But then there comes a time when you have very severe features. So we tend to give patients medications to try and control, mostly antihypertensive medications to these patients. And then we have drugs, steroids, that we give to help your baby's lungs mature, so that even if they're going to come out before time, at least their lungs will be matured, and we give them a chance of making it and surviving in the world. So when these features are improving on medications and monitoring, we can give you time up to around 34 weeks. And by that time, then you're going to be delivered. But then there comes a time when a patient has very severe features. You've given medications, you have done everything, but for one reason or another, the condition is not getting better. So in such cases, the advice, or rather the way forward, is normally to deliver that mother irrespective of whether the baby was 32 weeks, irrespective of the gestational age of the baby. And this is very important to save the life of a mother. So what I have seen is sometimes patients come in pregnant with high blood pressure, with very severe features. You've done so much, but there's no improvement. And you give them the option that the best way or the best thing for us to do here would be to get this baby out, either by inducing you, giving you drugs that will bring labor and allowing you to deliver normally, or in some cases, because of certain things, we are unable to allow you deliver normally and we have to go for a cesarean section. And you find patients refusing. So this thing is very dangerous. It costs lives. It costs lives. And in Kenya, high blood pressure in pregnancy is actually among the leading direct causes of maternal death. So from today on, let's go and have our blood pressure checked. Let's take our medications when we are asked to take them, and let's be positive. At the end of it all, we have very many women that have had issues with high blood pressure in pregnancy, and their babies are now okay. Their babies are healthy. If you have any questions, feel free to type in the comment section. And if you haven't subscribed to this channel, please do. A lot of love from me, and here's to wishing you a healthy pregnancy journey. Thank you.